My name is Nia Burrell, and this is my client, Yadi Torreya. Hi, Yadi. Nice to meet you.
Nice to meet you.
She is a 26-year-old female and weighs 130 pounds. So the basic emergency plan and procedure for this is that I'm going to have you get on the bike, and if you start to feel any kind of sickness like fatigue, you've got like chest pain, you're lightheaded, you feel nauseated, you get muscle cramps, then that's when I'm going to stop the test. And if this does end up happening, then I will have her just get off the bike and walk around, sip on some water, and when her heart rate gets back to normal, then I'll have her sit down and I will assess her situation. As far as the temperature and humidity in the room, it is 55 degrees with a 66% of humidity. And as I went through her medical history questionnaires and her PARQ, she does not have any kinds of risk factors that we need to keep in mind. She is a healthy individual, she's physically active, and things like that. She did not have any previous surgeries or is on a medication that will enable her to take the test, so that's also a good thing as well. She is a non-smoker. She does not have any type of hypertension at all. Her dyslipidemia, we did not have the chance to check that because of she has her life and I have mine, so yes. She's not pre-diabetic and does not have any history of obesity, and as far as her family history, she did not have any sudden deaths of any family members as far as her mom, dad, brothers, sisters, cousins, and things like that. As I stated earlier, she is a physically active woman, and the purpose of this test is to evaluate her cardiovascular fitness, her muscle endurance, muscle flexibility, body composition, and things like that. And so I'm gonna have her get onto the bike, and not right now, and she will go through an 18-minute test that will assess her cardiovascular fitness, muscle endurance, as I stated earlier. And the risk for this, for her specific body type, is that she will only have like muscle cramping since she is a physically active human being. So we would have to keep in mind of the muscle contractions. And the benefits for her would be she could assess where she is at physically and mentally. As the stages go on, it will get harder. So she will be able to have a good idea as to where she is at with her fitness level. This was on a voluntary basis. I did kindly ask her if she could be my client, and she accepted it. Cool beans. Do you have any questions for me? Any comments, concerns?
Yeah.
Okay, so I will have you sign this consent form for me, please, and date it. Just the first two lines.
Today. 26.
Thank you. So going through the test, I'm just going to explain it real quick. And so each stage is 3 minutes long. Every 30 seconds, I will take her heart rate, and she does have a Fitbit on, so we will monitor it through that, as well as I will palpate also. And then every 3 minutes, which is the end of every stage, I will take her RPE, which is on a scale from 6 to 20. 6 being the lowest, 20 being the highest, 6 meaning that it's like the easiest, and 20 being it is very hard and I'm tired and I want to get off. So that's basically it. And then as far as her blood pressure, I will take that every 2 minutes. So right now I'm going to have my client sit down in this chair, and I'm going to take her blood pressure and her heart rate. So for her heart rate, I'm going to have her sit with her knees at a 90-degree angle, and I'm going to have, you can sit back, and I'm going to have her place her arm on this armrest with her palm faced up. I'll do the other arm because you have your Fitbit on. And I will count it for 30 seconds and multiply it by 2, and that will be her heart rate. So you can keep 30 seconds. You can be there. Cool. So I calculated, well, I counted 38 for 30 seconds. So 38 times 2 is 76. Cool. And then, so right now I'm going to assess her blood pressure with the blood pressure cuff. And as I stated earlier, she's going to sit how she was sitting before with her arm on the armrest and her palm faced up. In order to take a blood pressure, you want to make sure that you have an adult cuff for an adult. You don't want to use an adult one for a 6-year-old child, because that just, you won't get any accurate results. It says artery on here, so what you want to do is you want to place it around her arm to where her artery would be, and just wrap it around tightly, and then we will go from there. So her blood pressure is 120/80, which is absolutely perfect. So as far as that, that's pretty much what you have to do before you want to have your client do the test. And so as of right now, the protocol that we are using for the bike test is the YMCA test, which is 18 minutes, 3-minute stages. And you would do the RPE every 3 minutes, the heart rate every 30 seconds, and the blood pressure every 2 minutes. And the purpose of this test is to just assess where her cardiovascular fitness is, as well as her muscle endurance is. And yeah. So as you see, my client is on the bike. You want to make sure that your client has at least 5 degrees of flexion, so you are basically mimicking walking, but at this point you are sitting on a bike. Also, you want to have the client's hands on the handlebars with their arms straight and their back as straight as they can. She is slightly bent, which is totally fine, because she's, you know, like, you can't really move the handlebars forward or backwards. Also, you don't want to have the client lean forward, because that will trigger muscle cramps, fatigueness, and shortness of breath. It'll also give abdominal cramping and abdominal cramping in the chest cavity, as well as the quads.